cannabis panel discussion. That is not a sentence that I would have ever imagined saying when I started with the Chamber about 6 years ago. But today we are developing new industries, and both the New Brunswick government and the business community have identified this opportunity, and New Brunswick is certainly working to be a leader in this regard. Of course, times of change also lead to uncertainty and to questions, and we've heard from our members that you need more information. The marijuana industry was one of the key opportunities identified in New Brunswick's growth plan, so we're pleased to have ONB's expertise available to us, and that expertise starts with our MC today and our panel moderator, which is ONB's CEO, Stephen Lund.
We have great opportunities ahead of us in things like research, testing and quality control, product development, extraction, seed development, harvesting, hemp, IT, genomics, and then the whole ecosystem that goes around this. We've got great experience, and we're capitalizing on it. We also have some great things already happening. RPC, that many people know, Research and Productivity Council, led by Eric Cook. They currently provide testing for more than 50% of the licensed producers today. I think they've just hired another 50 people in the last few months. We have 3 PhD level genomics researchers at University of Moncton, 2 research chairs in Fredericton, 1 at UNB, 1 at St. Thomas. CCNB has established Canada's first post-secondary program in cannabis cultivation. St. Thomas has partnered with Shoppers Drug Mart on research projects. At ONB, through Steve, we've been working with a lot of companies. We've helped 4 companies already set up in the province. We're looking at this in our shop from an economic development perspective. Revenue for the province, jobs, it is happening, and this industry is happening in Canada. We want to be at the forefront of it. We've already said that this industry will create over 200 jobs in the first year. We're already past that. 600 in the second year, and up to 3,000 jobs in the first 5 years. These are pretty realistic numbers when we see what's going to happen in the industry.
So if we're going to be the best at this and leverage the resources here in the province, how are we going to address this, and what are we going to do, and what sort of plan are we going to put into place for this? We know that the market on the medical side has been in existence for some time now. We know that the rest of the world in different countries, places like Uruguay, Israel, now in Germany, the Netherlands, they're all growing on the medicinal side. So they're looking for CBD type products out there, and there's been research happening in Israel and places like that, and Uruguay would be the only other country in the world that is legal on the retail side. The retail side, it's massive. Here in Canada, we will be the second country in the world to legalize it on the retail side. So there's incredible opportunities to leverage what happens here in New Brunswick today, and some of the things that Stephen alluded to was things like forestry, farming, fisheries. We've been the experts in the past around farming with potatoes and taking seed potatoes and generating an ecosystem here in New Brunswick that has grown to a point where we've got McCain's, who's here today, making French fries, and we're doing genomics, genetic work around potatoes, and we do the same thing on forestry. So when you take all of those things and you start looking about the ecosystem that exists here today, and then you look at the opportunities that we have in front of us, medicinally and on the retail side, we have some great opportunities in front of us. So when you start thinking about what you need to have success when it comes to growing a cluster, you need to have what we feel are these 4 pillars. So if you have the strength in people, you have the knowledge, you have the courses being set up, you have the research happening at the universities, and on and on and on, that's the way that you create a strong ecosystem to build a cluster. So then when you start thinking about the innovation, so Bruno's going to talk a little bit about it, and some of the things that Megan's doing as well, around the innovation on bio, the innovation that we're doing with the universities, the research. You talk about RPC being a world-class organization. They test over 50% of the licensed producers in Canada today. Not only are they testing for the licensed producers in Canada, but they're doing testing for other companies outside of Canada, some in the US and some in Europe. So then you start thinking about infrastructure. In order to build a cluster, you need to have roads, air, rail, sea, all these sorts of things. But you also need the other things that go along with that, with building a strong education system, making sure that education is aligned with priorities, and getting folks engaged in experiential learning, for instance, in our school system, not on cannabis, but on high-tech growing, this is exactly what it is. We have engineers working in these facilities. We have scientists working in these facilities. So to ensure that the infrastructure is there to support it is key. And then agility and capital. So we're one of the very few governments out there who have said we're in this game. So just by saying that we're going to be fostering the economic development activities in cannabis has put us in front. We've been recognized by the cannabis industry in Canada. We've won an award. We have seen a number of things happen across Canada when we're at events, when people approach us and say, you guys, what are you doing down there? There's also the veterinary side of things as well, which is now being researched to determine whether or not this is something that you can have for your pets. Manufacturing, greenhouse technology, I talked about the scientists, the engineers, all these sorts of things. These are jobs that our kids here in New Brunswick can look forward to. The opportunities are very wide in terms of what they have the opportunity to do as careers as they move throughout life. With that said, you can see there's a map here. We want to see that full. We want to get that to a point where you can't get any more little dots on there showing the ecosystem, the cluster that's building here in New Brunswick. Stephen mentioned that we have 4 licensed producers, 2 licensed producers today with 2 really close. There's another 9 in the pipe. We're talking to multiple companies out there. We're driving towards achieving a 3,000 job target. We hope that as New Brunswickers, this is something to be proud about, and we hope that everyone here will help us in building this ecosystem and building this cluster for the future of our children and our economy. So, thank you.
So, as mentioned before, New Brunswick was ahead of the curve. When I heard about the growth plan, I was sitting in the room at the Crown Plaza saying the province was going ahead with the growth plan, and I said to myself, okay, within 24 hours, I had an idea. Within a week, I put it on paper. Within 90 days, I get it funded. So we have 2 $1 million chairs taking place right now in the next couple of days. The first one will be announced at St. Thomas University to an international search. This one was made basically to address with our partners the social determinants of health. As you know, in health research, there's 4 pillars. Biomedical, the hardcore research, clinical trials, I'll be talking about. How can we improve the healthcare system and delivery? And the 4th one is social population health. So this one will be dealing with things which are basically impacting on public policy when it comes to for driving, for example, and the use of recreational versus pharmaceutical. The other one at UNB with our partners, Tetra Biopharma, is one of the youngest driving biotech in the sector, not only in Canada but in the world, who just got an orphan status by the FDA in the United States, for example, and TPD Health Canada allowed them to enter a phase 3 clinical trials with patients with cancer, actually pain. Basically, this one will be more on the aspects of running the biochemistry, the medical and pharmacology of cannabis, as we know is very complex. So this is the environment we're dealing with. Stephen mentioned already RPC, which is indeed creating lots of jobs in bioscience, and actually in the US, everybody knew about RPC, who capture more than 50% of the Canadian market and beyond the borders of this country at the same time. 131 diseases where cannabis is being studied right now. And we are engaged with these health charities in Canada to run these trials into New Brunswick at the same time through our system in both RHA's research services that we call Trials New Brunswick. And what will be essential for us is basically to get the funding to basically match with federal dollars and the partnership with the private sector at the end of the day so we can have this going. And I'm confident that we're talking right now with the federal government that it could be at least $15 million of health research funding coming here in the next 5 years if we get our act together nicely. Thank you.
From an employee perspective and an employer perspective, what are some of your rights and responsibilities in relation to cannabis? So I'll start up here. For employees around recreational consumption, what are some of your rights? So unless you're on the extreme end of safety-sensitive positions, for example, you're a pilot, employees are going to have a right to consume marijuana with some restrictions, legal restrictions, and employers can have some policies as well that employees would have to pay attention to. But that's one of the big change. It'll be hard for employers to defend a zero tolerance policy. So if you're sitting there thinking you're just going to ban it altogether, you may want to think twice about that. And generally, it's not the employer's business what employees do in their personal time, at home, and after work. Now, that's a very broad statement, and that doesn't always apply. And we were even talking earlier before the presentation started about how long cannabis can stay in your system, and that may have some implications. But what we do in our personal time, isn't always our employer's business. So let's jump down now. Employees around their responsibilities in relation to recreational use. So you need to be fit for duty, all right? We all have a responsibility to make sure that we show up to work not being impaired. Usually that's more straightforward with alcohol, may not be as straightforward with marijuana, and it all comes down into testing as well, which could cause some complications. We have a responsibility to follow employers' policies related to marijuana. But of course these policies do have to be legal. They have to meet the Human Rights Act, for example, and there should be some reasonableness around them just for HR best practices. Some people may be asking, could those policies include not smoking marijuana on work premises? And generally the answer to that would be yes. That's my understanding. So a lot of this has to do with an employee that's disabled and the duty to accommodate. And I think Alan probably will speak to that a little bit more. But a disabled employee currently has the right to be prescribed or consume medical marijuana. An employee has a right to be accommodated based on their disability, which may involve consumption of medical marijuana. And if the employee wants to smoke marijuana at work, you can ask the employee if they can use another form to administer the marijuana. There are multiple forms, so you would have a right to ask that of the employee, and then you'd have to work through the duty to accommodate process. Just a little bit more about employee rights around medical. If medication doesn't have an impact on the employee's ability to do the job, then an employee may choose not to disclose. Right? So this idea that an employee has to disclose isn't necessarily always the case. If an employee doesn't require any specific accommodation, they don't have an obligation to tell their employer unless they're in a safety-sensitive position, for example, a pilot, bus driver, that type of thing. All right, and to finish off around employees, around medical, what are your responsibilities? And that pretty much says it all. You have to disclose consumption of medical marijuana if you're in a safety-sensitive position. And there's just a little bit more about here around duty to accommodate. I'll leave that maybe more with Alan. And that does extend to employees that are disabled and to employees that have an addiction. Right? So just a kind of the rule of thumb is that if an employee is not disabled, there is no duty to accommodate. All right? So if it's around recreational use, you have an employee come forward and say, I'm a recreational user, you have a duty to accommodate me, the answer is no, you don't have to do that. Okay? All right, jump over to employers, probably where you're more interested. Recreational and your rights. So as an employer, regular workplace performance management would apply. So even though you're a recreational user, you still have a responsibility to fulfill the duties of your job, show up to work at time, be productive, right? That nothing around that changes. You do have a right to enforce anti-smoking laws in your workplace and create a policy around that as well. Pre-employment drug testing is a whole area on itself. We could do probably a whole day presentation on it, but that is something you'll have to look into, and I would suggest you consult legal counsel on that. A little bit more about your rights around recreational use. You can look at it in some ways similar to alcohol use, which most of us have dealt with. You can't have alcohol at work, you can't consume it at work, and you can't attend work while impaired. Right? So the same type of ideas apply. As employers, we have a responsibility to ensure a healthy and safe workplace. So you have to make sure that, that those responsibilities are being met. Once again, you can think of it as the same as you would do for alcohol, but it also applies to things like prescription drugs and over-the-counter drugs. In a lot of cases, marijuana, cannabis is no different in that regard. You have a responsibility to train supervisors and managers to make sure that they can identify impairment, respond to safety concerns, and I would recommend that you have some policy wording around that. Rights around medical. Once again, for safety-sensitive positions, employees are required to inform you that they're using medical marijuana. Once again, you should probably consider having some policies around that. And also, if you have employment agreements, that would be a really good place to have some wording in that regard. Duty to accommodate, does the employee have documentation? They should. If not, it might be a self-prescribing type of situation. And you can work with your doctors. You may have some questions around how to accommodate that individual. And then dropping down finally around employer and responsibilities around medical use. You need to find that balance between the duty to ensure a health and safety work environment that I was just talking about, duty to accommodate someone that has a disability, and then also a right to privacy in terms of what information you can ask from an employee. And keep in mind that for safety-sensitive positions, your rights and responsibilities probably will be different. So just some do's and don'ts to finish off. Apply these regular principles of duty to accommodate. Treat people using medical marijuana like any other employee with a prescription that could affect their ability to do their job. That might be an overgeneralized statement, but pay attention to your policies, create some new policies around it, assess safety-sensitive positions differently. Don't strictly enforce a no-tolerance policy. Allow medical marijuana to create impairment at the workplace, sacrifice the health and safety of the workplace, and then be careful of the stigma is the last point.
This morning I'm going to discuss recreational marijuana use in the workplace and medical marijuana use and what the responsibilities of employers and employees are. So I guess the first point is if you can't be drunk at work, you can't be high at work, and that is a big takeaway. Employees must show up fit to work, and I guess the caveat there is unless you have a medical prescription, but for recreational use and the rules, employees must show up for work, fit to work, and they can't be impaired in any way. So the rules that apply to alcohol abuse in the workplace will apply equally to recreational marijuana use. The number one defense is going to be for new employees to incorporate provisions in the employment contract, and for current employees to have very clear policies that address some of these issues. Unfortunately, the legal landscape in Canada has been very reactionary versus proactive. What we see developing in case law and in legislation is a reaction to societal issues. So people are using marijuana in the workplace. There's a societal appetite for change and policy change, and we're seeing legislation try to catch up to the already moving societal pressures. There's a recent Supreme Court decision, and this one is a little important, Stewart and Elk Valley Corporation, and in this case it was a safety-sensitive position, and Jason alluded to that before. He mentioned a pilot and a bus driver, that sort of thing. It's really anything that could impact public safety, so it's a lot broader. Factory workers, anything where machinery is involved. There's all sorts of safety-sensitive positions. In that case, there was an employer's policy that required all the employees to disclose a dependence or addiction before any drug incident occurred. And if the drug incident was disclosed, then the employer would offer treatment. If it wasn't disclosed and an incident happened, it was automatic termination. And in this case, Mr. Stewart was involved in an accident, and he tested positive for drug use. And he told his employer that he was addicted to cocaine, and that it was a human rights issue, and there was a duty to accommodate triggered. And that would be true, but for the policy. So he brought a complaint to the Human Rights Commission, and it went all the way to the Supreme Court of Canada. And the Supreme Court of Canada said because of the policy, he was actually terminated for breaching the policy and not because of human rights issue. So it sort of eschewed all of the issues of human rights, and it was a much cleaner way to deal with the issue. So the takeaway under the legislation is that employees need a prescription from Health Canada, and not just any old prescription, and they need to be registered in order to possess medical marijuana under the current regulatory scheme. And as employers, you've got the right to know you don't have the right to know what the employee's condition is, but you certainly have the right to know that the medication is required. Now, we recommend to clients who are faced with an employee that says they've got a medical prescription and they don't provide sufficient evidence or they don't provide sufficient information to actually write to physicians to find out what the conditions are. So, like I said, you're not entitled to the underlying diagnosis. That crosses too far into the employee's privacy rights. But you are entitled to know what the conditions are and what the employee's ability is to perform their job. It's important to craft a detailed letter to the physician, and there's obviously varying opinions on what's required. And it's important to be careful what to say to the physician. Only say what's necessary. There's been lots of cases where, the employer will put bias into the letter and say, oh, this person's been smoking on the job for 15 years, and then later there's a termination and the person gets reinstated if they're in a unionized context because, no, that tainted the medical opinion and that sort of thing. It's better to be brief. We ask that given the work hours and the job duties, would you recommend that the individual or when do you recommend that the individual ingest and at what dosage level? And we say, is there any risk that the employee won't be able to perform any of the duties in the attached job description? If yes, no, and if yes, why, and if no, why not? So it's important to seek legal advice if necessary, certainly HR advice, and to not treat everyone the same. You certainly can't apply the same principles to everyone.
Today I'm going to talk about cannabis, the great opportunity for New Brunswick. At least we feel that it is. So we are starting with a base here. We've got available space. We've got inexpensive land. We have the most inexpensive agricultural land in North America and in Europe. We've got building blocks around genomics, cultivars, seeds, the starting components for cannabis. And we have significant agricultural expertise, about 150 years worth of it. We have producers for both of these. They intersect around research support, and then you've got all these supporting cluster technologies that actually work for marijuana, hemp, cannabis, you name it. On the producer side, we've got growers. We have significant underutilized farmland here in the province of New Brunswick. We only farm about 5% of what we farmed 75 years ago. So if you think about it from a hemp perspective and CBDs coming from hemp, we have a massive opportunity here. And if you take a look at the basis that we're starting with, you can understand where that opportunity starts to intersect. We also have a number of licensed producers currently online, and then as Steve mentioned, we've got a number of other ones coming online as well. Then you've got the transformers. These are the companies that are going to take those CBDs, THCs, et cetera, and create natural health products, food, and pharma, both on the marijuana side and on the hemp side of things. Then we've got the research support. This is where it starts to get interesting. This is not an exhaustive list. This is just some of the research that's sitting in our backyard that is currently working on cannabis. You've got all of our academic institutions. You'll see RPC up there. You'll even see some of our federal and provincial research institutes up there as well. A couple that you might not think much of, if this little pointer works. Huntsman Marine Science Center and Coastal Zones Research Center. These are two aquaculture and marine research institutes in the province. Huntsman's over 200 years old, and Coastal Zones is up in the 30 range. There is significant opportunities around utilizing both hemp and marijuana with animal, fish, you name it. And they're currently doing research on that. So the real value in this value chain is taking these products that our transformers are then creating and turning them into exports and money and GDP back to the province. So what is the opportunity? The opportunity is seeing the big picture. At BioMB, we're really good at helping to commercialize technology for early stage companies working in the bio space, but the other thing that we're really good at is we're really good at putting the big picture together, all the pieces of the puzzle down on the plate. We have existing assets. As I mentioned, we have significant agricultural land. We have a growing research capacity, both academia, federal, and provincial. And we can tap into existing technology companies that already have supply chains here. We've got the pieces. Attracting new investment. This opportunity around cannabis in the province is about bringing new technologies to support indoor and outdoor growing. New technologies to transform that biomass and create new products, and that's where we're going to get the export and the GDP numbers. A convergence of technologies. This is something that we don't talk much about, and I'm glad that Steve alluded to it. there will be a significant convergence of a lot of the priority factors that the province has already started to take a look at, everything from cybersecurity to new farm entrants, etc. But this also involves artificial intelligence, blockchain, ICT, genomics, and the convergence of sectors across the plate: forestry, ag, aquaculture, you name it. The agri-tech and precision technology opportunities, there are going to be hurdles with indoor and outdoor growing, and we've actually got a lot of that expertise here already, and it's been in play for over 100 years. Technologies to support smart grid, clean tech, and cybersecurity. Some of the biggest threats related to indoor growing and outdoor growing are our inputs like water and energy, and then the security around the IP of these products fits directly with smart grid, clean tech, and cyber, which are all focuses for the province as well. Agriculture and aquaculture, if you are a vet, if you work in an animal feed organization, if you work in animal nutrition or husbandry, the potential for animal applications is considerable, and it's growing every day. Not just on the animal companion side of things, but on the actual industrial aquaculture and fisheries side as well. On the human health, precision medicine and new drug development, as Bruno alluded to, has been growing exponentially and will continue to grow. So that's a massive opportunity, and we've actually got a lot of that research capacity here. Thanks.
Most importantly, I'm a medical cannabis patient. I began using cannabis to treat my PTSD in 2006. In 2015, I gained access to regulated product, which changed my life. Having access to known cannabinoid profiles, as well as the Veterans Affairs Canada coverage that provided me that medicine through their insurance, literally changed my life. So I'm very, very passionate about our mission in this space. I'm going to talk a brief history about medical cannabis. It's very unique. Patients fought for their right to access medical cannabis, and it was actually through a Supreme Court ruling that led to the legislation, now the ACMPR, to allow patients to access this for medical purposes. So as amazing as this ruling was, many significant challenges were identified. The lack of information available to the medical community, the lack of data, the administrative burden associated with prescribing. Physicians didn't understand the processes and the criteria. Education, who was to educate the patient, who was to help them understand how to use this medicine, and really what was the efficacy and the safety. We didn't have the data to really understand this. So patients are referred to us by their family doctor, which serves to validate them as a truly medical patient. And that's basically our goal in this space, is to validate the medical patient. These are all of the different regulations, and there's some more I could have piled on there that we have to be mindful of and operate within. And for people to understand kind of what we did, Mike and Fabian identified a real gap, a void in the ACMPR. Patients didn't know where to get a prescription, doctors didn't know how to prescribe, and licensed producers didn't know how to find a prescribed patient that they could legally sell their cannabis to. So we basically became the interface between the patient, the physician, and the producers. And since there was extremely high demand and need for our services, we grew quickly. 11 clinics in 6 provinces. We've currently served over 14,000 patients. We currently move on a monthly basis 500 kilograms of regulated product to licensed patients through over 20 licensed producer partners. So of those 500 chronic pain patients, we have identified that 96.8% showed an improved quality of life, 96.8% reduced use of pharmaceuticals, 88.2% reduced use of opiates, and 40% halted opiate use. And these are pretty early statistics, and we'll have much, much better numbers on a much larger basis with our new CPM, which we'll be launching soon. But these are staggering numbers, and this is what we've suspected, and this is what we expect to be able to show the medical community. Well, thank you for your time.
So we've got some time for questions. I've got a few, and so I'll open the floor for questions.
How can New Brunswick present itself on the global stage in the best light? How should we be portraying our intentions?
There's no doubt that basically this is going to be growing on a world scale, and at this international conference just came back, lots of countries in Europe, Israel, were present at that conference as well. So there's an opportunity there to connect with all these people.
Because research is great. I'm a researcher myself. We need to kind of bring the industry of clinical medical cannabis forward here in this province. So I'd like to see the vision on that one, because as it says in Proverbs, if there's no vision, the people will perish. So I need to see that.
131 diseases are basically being looked at the end of the day, and listing a couple of charities. What are the beneficial effects of cannabis-related compounds that will be extracted as a whole product onto ALS, MS, neurodegenerative disorders, osteoarthritis, and the list goes on.
Just wondering if you see anything in your travels.
I think it's actually a real opportunity with the U.S. until the U.S. market opens up, and frankly until the European market starts to make changes too. It's a real opportunity for us here.
When we would put, and we're working into putting $100 million funds in Canada for the next 4 years in health research, the U.S. being 10 times bigger can put right there $1 billion easily. It's the same thing that happened with Alzheimer's research and diabetes, and the list goes on.
To Bruno's point, where there's 4 levels of paperwork required to get certain approvals, we're already seeing some of those complications with recreational marijuana. In Canada, certain municipalities don't want, not in my backyard thing. So we haven't seen the legislation on that yet, and we don't know how the provincial government is going to respond, and that's partly because we don't know what the content of some of the federal legislation is.
When the legislation comes in, do we really see companies stepping up today, or do you think it's going to be a wait-and-see approach?
For any organization that doesn't have any policy, then I would recommend they start taking a look at it. But I believe there will be some bumps in the road as we move forward, and yeah.
Is there work being done right now in terms of educating the general public along with employers about any information they need to know around recreational and medical use, primarily recreational?
So I can tell you right now, and I don't know the dynamics of everything that's happening, but those conversations are happening internal to government on how they're going to start going out to the public, start going out through the school systems, and start having those kind of conversations.
We're still early stages. We know there are lots of questions out there, but we also know that there is a significant opportunity for our province, and so we do appreciate the interest in our discussion today.